different things like that and how you're set up. But remember, there's a lot of smaller agencies that we've even got, they're still writing stuff down, or they've got they've got Excel spreadsheets or whatever. But whatever data system you use is what we're going to talk through on the categories. And there are specific categories in this data collection instrument that's in front of you as well. And so you'll just kind of want to make sure, and I'm kind of an objective driven person, so here's how it is defined. You may call it different things in your system. Just be able to correlate what you call it to what element you need to insert into the data collection tool. Does that make sense? From a simple best practices issue, it would be to say, hey, I'm just going to mirror what they have and let me go and change it so it makes it simple. But we're not advocating you do that either. So if you've already got a name and you call your paramedic something different, or you call your administrative individual something different, just know where to categorize them when you're inputting the data in so the data is accurate. So you're going to actually look into 3 different categories here, folks. First of all, you're going to have what you call your EMT response staff. That's pretty much your frontline staff. You're going to have your admin, facility people, so anything that I would call support services that aren't really actually on the truck. And then you're going to have your medical direction piece. Okay, and we'll kind of go through the medical direction piece because sometimes this stuff is volunteer. How do we equate that, especially that you've got emergency medical directors or emergency physicians that may work at a hospital, and you have a small service that they're like, oh, we'll just donate our time because of the public service that we do. People they just want to help and assist, and that's what makes us so unique as a healthcare profession, is that we are technically still public safety. Even though we're trying to put ourselves into the healthcare piece of it, and it's what causes the interesting dynamic nationally regarding our field. So here is some of the stuff that you need to think about when you're looking at response staff and how we've got them identified. Typically, it's pretty easy with the EMTs, the paramedics, your EMRs. Here's where it gets a little interesting, is if you have a firefighter EMT, there's a lot of fire departments in here as well. So you're going to want to differentiate between the two. And this is where we're going to really begin to talk about shared services and allocation. All right, so if you're a fire department, police department, and they're filling dual roles, so Medicare is going to allow you to capture the cost for the firefighter EMT that responds to an ambulance type call, but not to a fire. Okay, and so you'll have to begin to allocate that in your system. That is new to the industry. And this is where they go into when you're going to see a lot of discussion talking about allocation rules, and you need to be able to allocate this appropriately. This is where it's going to get complicated for those for some of those nuances. If you're a supervisor, sometimes you've got EMTs that are functioning in dual roles. They might be supervising but also jump on trucks. All right? And this is where it comes down to what they're categorized at the beginning of your reporting period. So if you're on a calendar year, January the 1st, however they were categorized. This is very common if you've got an EMT basic that's in paramedic school and they were an EMT basic on January the 1st and became a paramedic on July the 1st, you would capture them as an EMT basic for the whole year. Okay? Remember, we're doing aggregate reporting as well, so it'll all wash out in the general numbers. Even though you might be putting salaries into the EMT basic role. But if you're on a fiscal year, starting July the 1st, whatever your reporting year is, that is how you're going to identify what position your salary, your individuals or your employees were in at that time. That makes sense? Probably been a big question for a lot of people, but CMS has clarified that at the beginning of the year. Your admin staff is exactly what you think, guys. Any support staff that is not on the front line and doing clinical care. It's the easiest way to look at it. Everybody calls them different things in different departments, but this is kind of the nomenclature that we're trying to use throughout the process is supervisors, call takers, dispatchers, whatever you call them. If you've got custodians, maintenance, however you're defining them in your process. And then your medical directors, whether they're employed or volunteer. Okay? There's also some people that have them under contract. Yes?
What if you have your admin staff that are
So they act as a backup. You would categorize them as admin. Okay?
Vehicle maintenance, if we have someone else do our vehicle maintenance, is that just, that's going to be somewhere else, right?
Yep, it's going to be contract services. What I'm talking about right now under labor costs is going to be what is paid, what you currently pay in salary. Think W-2. Think W-2. Probably easiest way to say it. Yes, Ron.
In Michigan, almost all places, we have a medical control authority for our medical direction actually comes in kind of meet. So in some cases, they're paid medical directors, and in some cases, they're volunteered. And in some cases, the medical control authorities charge the agencies, and in some cases, they don't. How should agencies?
So they'll be contracted. So there's different ways to report that. You're going to either do it under paid, volunteer, or contract. The important thing to note is, because we know there's a lot of different nuances here, is that there's different areas to report it, is that you report it only once. Okay, so it's not as concerning if you get it out of order and think, you know what, I really think this sounds more like it's contracted to me, based upon in the Michigan, the authority, they're paying it contracted. I would put that under medical direction, under contracted services when I go over other costs, when we get into contracts. If it's paid, that's pretty simple. I'm paying him directly from us as a W-2 employee. You're going to see that. Oh, are there volunteer? There's a way to say this is volunteer, and then you put the hours in that they're volunteering for you.
So, biller or billing staff, so we use a third-party billing company. Since I don't pay them a W-2, I'm not accounting for them.
Not in here, not in labor. You will under a different area. Okay, if it's W-2, easiest way to look at W-2 volunteer, you're going to put them in your labor. Yes, ma'am.
We're a township, and our Treasury Department takes in all the receipts for all the ACHs and the payments that we receive. Would that be allocated out?
So you are going to, like your payments for the revenue side of it?
Yes.
So the reimbursements that you get from the insurance companies and different things like that?
Yes. Our
So-
Treasury Department takes all the.
That's fine. We'll show you where to calculate the revenue shortly.
I mean, their time.
Oh, the time for it. Okay, so when we get under shared services, here's where we're going to go here. So if it's not W-2 yet, then we're going to show through allocation of that, and that's where your finance and your support departments that are going to be allocated. So it makes it pretty simple for you if you're W-2 under your NPI. Once you get into shared services, here is going to answer some of your questions because a lot of governments are in the room. So this is where how you allocate is going to be extremely important. Now, I am making assumptions, and like they say, don't ever assume. But typically, finance departments, if they're doing it for the mayor's office, the police, the fire, all these other governmental entities, theoretically, they should be allocating appropriately to each individual. A lot of times what they do is they just assign it across the board granularly, like say every department's going to get, we have $100,000, we're going to distribute it, we got 5 departments, everybody gets 20%. Some people do it like that. Some actually are going to go down to the finite and say XYZ's budget's this person's assigned here, so I'm allocating 18% of that cost to EMS, 22% to the mayor's office, 75% here, however the numbers are till they get to 100%. However you do your allocation, you just need to be able to justify it. If they aren't currently doing that, you need to get them to do it for this project. So if they are not assigning any cost to your department in your example of somebody doing that, and they're not assigning any cost to EMS, you need to get them to assign a cost, or you're going to underreport. And that's our concern. 2/3 of the ambulance suppliers and providers are governmental entities. Okay? So if we do not allocate correctly your service, and multiple people report like you do and don't allocate the shared service out appropriately, then we will underreport. And so what will happen is it will make it look like in the aggregate we're being overpaid, and this is what happened to the home health industry. So this is the reason why I'm taking time on this, because 2/3 of our industry are governmental entities, and more than likely they are sharing services.
So you say, so like our treasurer, so all our payments from our insurance payments come in, the treasurer lots them, puts them in the budget, however he does his thing. He needs to allot what percentage of time he spends doing that EMS.
And if it is 10% of his time per month, then 10% of his costs and associated costs under that umbrella should be associated with EMS. Does that make sense? Because think about it from a standalone. If you were a standalone, you would have to have all those functions doing it for you. Correct? So that's how you should be thinking if you're a governmental entity. If I was my standalone entity, all these support services that I may be getting from a finance and from a governmental entity, I'm going to have to do myself. So I work for a very large ambulance service as well. I incur all of those expenses. So to be apples to apples, we need to make sure we're allocating across the board, especially when we're doing aggregate reporting. This is what didn't happen in home health. So we are trying, this is the reason why we've got this show going on the road, educating everybody, because a lot of people have said, well, the governmental entities have a lot more expense. Well, when you don't think about it correctly, you are going to underreport because of issues like this. This is our concern. All right, to make sure we're apples to apples. Yes?
What do you do about dispatch services that are county? They do police, fire, EMS, and you're the EMS provider.
Same concept.
How do you allocate that if they don't give us a cost or a fee for the services rendered?
They really need to associate a cost. I mean, literally, that's what you're going to have to go back and do.
So get a cost from the.
Yes, I mean, like if it's costing the county money. So if it is $3 million a year to do dispatch services, and EMS is 40% of the call load, 40% of the call, even if it's not saying you have to pay them, it's just paper. They should be allocating 40% of the $3 million to EMS.
So based on the number of runs that they dispatch?
Well, I mean, however, that to me, that makes sense that that's what they should be doing. But your finance director may have some other concept around that. But they need to be assigning costs to your entity. We're not going to tell them how to do it. I mean, we can give you best practices on what we think it should be.
Well, and you can tell them that CMS said you can use your allocation.
Yes. You.
The trick is to document how you did it so that if it comes back later, you've got a paper trail of this is how we allocated and this is why. But you don't have to use a specific method. You can use one that works in your organization.
And right here is the important piece, guys. Right here is the important piece to notice is anything that is partially or fully related to ground ambulance. So you can only allocate what was for the ambulance division, not air, not fire, not police, not anything else. So your allocation rules are going to have to make sure that anything that you do only is impactful for air and ground. That includes salaries. So if you're paying salaries and you're a fire department that also does EMS, and you commingle the two, you're going to have to allocate that out as well. So if you've got a fire, say for instance you're a firefighter, chief EMT as well, he's a paramedic, he spends 80% of his time doing fire-related work, 20% ambulance-related work, then 20% of his salary would go into the cost. That makes sense? That's why you've been answering. We know we did all those organizational characteristics and you were answering those questions. If you say yes, that you're a fire department, it's going to now drill down into this, into the tool that's in front of you. And this is where allocation starts.
So for the labor, so my treasurer, for example, he gets W-2'd by the city just like on my report. So is his portion of his cost going under labor or under the shared services?
So it's going to go under, so you would have labor in there. Whoever is paid is going to be more maybe contracted. Either way, however they've got it, you can either put it under labor or you're going to have it under the contracted services that you share. But it's very important that you only report it once, okay? And they're pretty specific in the tool about that. They understand that people are going to interpret differently just like you are. Well, I've got this. Do I put it under here or do I do it here? Just do it in one place. That makes sense. Here is what you don't include. So this is very important. This is very intuitive in the tool. We've just tried to break it down for you guys. But like her question say, if you're not sure where to put it, just put it once. It's not really incorrect as long as we're capturing the information in the total cost. What they just don't want is over-reporting to where all of a sudden that you become an outlier and they just remove all your data out because it's very glaringly obvious that maybe you've over-reported. because that will happen. And we're just trying to make sure they don't remove data that's actually good data. You just have over-reported. Okay, when they get into aggregate reporting, that's kind of what they do when they're looking at statistical samples. Okay, you do not include all your employees as well. So when you look at this, asking for these responses from other organizations, so you're not going to want to lower it all. So don't include everybody. You only include what's related to ambulance. Okay, and a lot of you are going to be shared services in here, especially if you're a governmental model. More than likely, you are a shared services model. And that's where it gets complex. Organizations like mine are shared services only because I have multiple NPIs in a corporate organization. But if you only have one NPI, then you're probably not going to be shared services. And then our shared services takes on a little different context, not shared services from how governmental entities are doing it, but just shared services on my corporate within whatever NPI number I'm reporting on. Okay, here's where we get into your salary. Now, these are the actual categories as listed in the tool. All right, these are the exact categories. Now, your categories may not look just like this. You just need to be able to equate them to each one of these. Okay, intermediate is going to be interchangeable with AEMT. That's where you'll put intermediate if you have an AEMT. That's kind of the more recent nomenclature we're using as an industry as well. Paramedics, pretty straightforward. If you're W-2, if you're volunteer, if you are not making minimum wage. Okay, so if you've got paramedics, you say yes, and if I've got some that are making less than minimum wage because we have those different dynamics I was telling you about, you might be paying them a stipend, and then but over the year, piece of it they were making, you might have some volunteer as well. So you would answer yes there, and then it's going to drill you down into other information. On any of these categories, whether it's EMTs, intermediates, or AEMTs, paramedics, nurse, doctor, respiratory therapist, if you employ them, especially if you do specialty care type transport work, you might have respiratory therapists, nurses writing on some of your units. Your EMRs, your ambulance drivers that are non-EMR. Medical directors, same concept, guys, paid, volunteer. If it's contract, there's another way to put that somewhere else. But if you don't remember, if you put it into another section, just don't put it in here. And then all others. There's always an all other everywhere that you would actually pre-fill in that you've got some others or what have you. But you want to use that as sparingly as possible because remember, when you free-form something, it's harder to extract data out of free-form fields. So while we've got others, blank fields are something you want to try to stay away from if you can get them into these other categories, because when they look at on the granularity, if 70% of the industry is putting almost all their salary in other, it's going to be very complicated to try to tease out. So most of us probably have our staff categories where we can plug and play into these categories. You may not have listed them as such, or you may have different names for them because you might call them firefighter EMTs or paramedics or whatever you may be doing as far as just be able to crosswalk them to this.